Hi, so I'm trying to do this live here, and first time I do this, so please. Está. So, I guess, yeah, there it is. Oh my God, thank God. It worked.
Good.
Oh, I'm sorry about technical difficulties. So the Facebook Live won't happen.
Okay.
Sorry about that. Again, technical difficulties here. First time to do that as well. Well, thank you. I just want to briefly say just a little bit of introduce you a little bit,
Okay.
and if you could continue with that. So this talk, hi everyone. This talk is about soul loss, certain causes and symptoms, and also cures. Here, my friend Abigail Mclam, she's a traditional and alternative healer. I've known her for a few years. It's someone I respect a lot. I respect her work a lot. She's somebody that has gone very deep into recollecting and understanding and learning from very different sources. And one of her specialties, although we won't speak about this today, is healing of the womb and the female reproductive system. So, well, please, Abigail.
All right. Thank you, Alejandro. It's been great getting to know you and work with you over the last couple years. This work is certainly near and dear to my heart in my own evolution of my own healing. So working with this with clients that I see nowadays, it is evolved into a big majority of my work. And when we say soul loss, as a Westerner from South Carolina, it means a lot of different things. So it's interesting to be able to bridge both languages and worlds from coming from a Mayan tradition, which is part of what I respect that you bring into this learning process. And in my own work, getting to dialogue with clients about what does this mean for them, what is showing up in their lives, and why is it that this work seems to be more and more prevalent or more important to the people that we're working with. So I'm excited to talk about this topic. I think it's certainly something that you and I have talked about a lot.
Oh, yeah.
And this is a new platform for both of us. So thank you all that are listening. It is, new and exciting to be able to bring it to a bigger population. So thank you for setting it up, Alejandro.
I think we sound very solemn. I mean, Abigail is really my friend, so.
Yeah, we sound very, very official, but we've been friends for quite a while. For sure.
First question comes into mind: what would somebody from South Carolina would think when they hear soul loss?
So there's a cultural aspect that comes to mind for me around religion, around what does this mean? Is this something that is against what they might be practicing? But for me, the way I like to explain more of soul loss is about the bigger picture of what do we know as ourselves when we feel whole. And when we are whole, we also know times in our life when we're challenged and feel like parts of us are missing. So our soul in a bigger picture is about our spirit. And like what I like to explain to the people I work with is that it resides within your heart. And it's a space that we all know well. And when our heart is broken or when our heart is hurt, that we know that feeling on a physical, mental, emotional, and spiritual level. And so when we speak of soul loss, it's about heart pain. It's about heart loss. It's about those pieces of us through life as it shows up that are difficult, those shadow pieces. And so what I like to frame it as when I work with people is that soul loss is one way to describe what it is we're talking about. If we want to describe it as hurt hearts or whatever it might be, the language is less important, as it is about connecting to the source of it, which is the spiritual component, which is about parts of ourselves that get lost through life experiences, sometimes early childhood, sometimes later in life. But ultimately, the signs and symptoms of soul loss or spirit loss end up being pretty similar. And you and I have talked a lot about that, about what is the similarity between these signs and symptoms and what shows up.
It's interesting that I mean you work so much with people and help them with this, and well, where shall we take? Because I have a lot of questions for you, but
I know.
all of a sudden it got super cluttered. But so how did you start getting with an example? How did you get an awareness that there was such a thing as called soul loss? And it's interesting because soul loss is very linked, or very linked to trauma.
Mm-hmm.
And still you haven't spoken,
Mm-hmm.
no, that word.
Mm-hmm.
Well, why haven't you spoken about it? And then how was your first awareness or consciousness that there was a soul loss?
Mm-hmm. So I think for me, my background's in counseling and social work, but I've been a bodywork massage therapist for the last 12, 14 years. And so what I kept seeing as I continued my education in more of this spiritual practice component is this piece of people that feel like there's a part of them that's missing. And in this exploration, what I found through a lot of different studies internationally is that this conversation around soul loss, and soul loss in the sense of trauma creating these fractures within a person's soul. So when we have trauma, whether we call it lowercase t or capital T trauma, which are little traumas or super big events in our life, little parts of us or chips of our soul get fragmented or fall off that ultimately create this sense of inability to know oneself, or a lost feeling, or a feeling of depression, a feeling of chronic pain, unexplainable events in physical ways or manifestations. And for me, what I kept seeing with the people that I was treating over more so the 5-10 years in doing predominantly body work was this conversation around, I just feel like this is never going to heal. Or whether it was the shoulder, but if we dug deeper, there was always a story around a trauma that occurred at a certain point in their life. And the more I dug into that, the more I started to understand that this is a bigger aspect of all of us as humans, this spiritual piece of ourselves that we may have lost along the way, whether we grew up with a religion as a spiritual person or we have meditation, whatever it might be. As a collective, we all identify to this conversation around who am I in my soul? And when these events that we can call trauma occur, we lose parts of those. And how do we get them back? So that's where my work started to navigate into more of using plant medicine, using more direct dialogue and body work to help people gather those parts of themselves that might have fallen away along their life experience.
It's very interesting how we spoke about this, like
Yeah.
you being aware of well, doing body work, no, with your clients, but working through the body gives like a different perspective versus somebody that not that it's better or worse, but somebody that does journeying, for example, only. No,
Yeah.
it gives you a very profound insight and very like present. I don't know if, like
Yeah, I think that's a great word for it. It's like
immediate, like super
creating this this immediate presence. Because if we think about it, so much of this work can be very ethereal, it can be very external, it can be very theoretical, and it's easy to get lost in the external of it. But when we bring in a body work component, we bring in the body, which is the most grounding piece of being human.
Right.
And it's one of my wise teachers always used to say, the body is inherently wise. It's always in conversation, and it always teaches us what our truth is. So our minds are designed, for better or worse, to help us overcome these pains and that our body might squawk about. So when we start to integrate both what the mind might be saying and what the body might be actually feeling and bring the emotion into it, then we've got an actual foundation in which we talk about. So a lot of this work in soul loss is about, what does your overall foundation of self look like? What does your emotional self look like? What does your physical self look like? What does your mental self look like? What does your spiritual self look like? And all four of those pillars of your truth in alignment. And so when we see this soul loss piece come up, oftentimes one thing is dominant. Oftentimes in Western culture, it's a mental component that says, oh, life has to look this way and do this way and act this way. Meanwhile, the body is screaming. Or meanwhile, the emotional self is completely cut off. So that was sort of the pattern that led me to a lot of this, is, wait a second, this is a conversation that keeps coming up. What is this about? Which got me to dig deeper into more of the work that we have talked about, Alejandro, which is with Julio, with Sofia, with the indigenous healers that we've worked with, that have a broader, I think, lens around, okay, there's bigger pieces to this than just this one structure or one journey or one whatever it might be.
Than just the mental and the physical only.
Right.
No?
We can't really just focus on just the physical either. We can't just focus on the therapy of the emotions or the mental structures that influence all of this. And in my opinion, it needs to be all four. And that is where I feel soul loss or soul recognition comes into alignment, because to be in your soul means that all four of those parts of yourself are in awareness and are present. Whether they are lacking or painful, that's part of that conversation. It's not to fix all at once. It's just to be acutely present with what is happening in the body or happening in the emotions and mental and physical self.
Yeah, I told you a couple of days ago, situation with my friend, right?
Yeah, that's a great example.
Specific pain in her body. And then she just said, you know what, I have this pain. And she was aware that there was something besides the pain. And then she started speaking, and I was just there listening. No, and all these things came up, and then just the pain just went away when she was able to speak, but being conscious of her body and what was happening within her body. So what was like your first experience with soul retrieval? Was it you helping somebody, you in a course, or somebody helping you?
I think it's probably all of those, but one that sticks out in my mind was specific to a chronic pain patient that I was working with for a long time, in more of a bodywork perspective of this shoulder pain that would go all the way into around her heart. And we were working for months on releasing this trauma that was in what we called an injury in her shoulder. And the more we dug into the muscle tissue, the tighter it got. The more I used all these different tools that I came into. And this was the time in which I was starting to study soul work, soul retrieval work. And I remember distinctly one day in this client treatment, I said, you know, we're going to try something different. We're going to do a dialogue. We're going to talk about what comes up in your emotions, in your feelings. And we call out 5 main common feelings, which are going to be grief, sadness, anger, fear, and disgust. Those are, in Western world, are primary within the structure of psychology. So we're going to talk about these 5 feelings. When I touch your shoulder here, what feeling first comes up? And it was this anger. We said, okay, let's pull this apart. And we talked about anger and where when she gets angry, she feels a tightness here. And we tracked it and where the body would show up. And then we went a little further. Underneath that anger, there was deep, deep grief and sadness. And it had to do with a heartbreak that she had experienced about a year prior, where a partner left suddenly and her heart was left broken. She came home and all his things were gone. It was absolutely devastating because they were on this tract. And she was an engineer, so everything for her in her world was very structured. And so this was not the structure that was planned. And so within the soul loss component, we worked on what familiar emotion have you felt in your child self that mirrored this. So we went back to a smaller self, which was about age 6. Immediately, she could call recognition of this feeling of betrayal and abandonment and where this showed up. And when we talk about that, that is trauma. But I tend to go away from the word trauma because it brings up all kinds of different feelings, like you're broken. And this isn't about being broken. This is about being human. And for me, more of the conversation of that feeling of loss or that feeling of betrayal or that feeling of abandonment, where you're alone and sad and deeply, profoundly struck by this experience, your body goes like this, right? So this shoulder was a teacher about, for her, how she's still going like this in her life and walking like this. So we were able to call in her emotions, identify some of what she was still guarding. She didn't want to date again. She didn't want to ever experience that again. So there was a cutting off of this limb that happened. And this is her words of paraphrasing of her experience of like, she just wanted to shut that off because of how deeply that was hurt. And in this language of soul loss, that is a loss of soul, right? That is a loss of your heart in which it broke open or broke into pieces, and collecting these emotions back and allowing her to understand that we need to create some safety around this heart so that you can trust again was part of that conversation. So for me, the soul work in that instance was a profound shift in a lot of how I started to dialogue, bring in more of my counseling work, because I was conditioned to believe that counseling was separate from body work. But what I found when we bring in the body and the counseling together, so much deeper emotions show up. And there's so much deeper shift. So that for me was probably my bigger pivot in some of this work, with clients at least.
Okay. It's interesting how you mentioned trauma being like a stigmatized term or word, and
not to say that it's not important. It absolutely is.
No, but I it is. It does have a weight. You know, it's broken. But it's interesting how in indigenous communities and some non-indigenous communities, but how they don't speak about soul loss as trauma. It's just like, no, perdiste la sombra, no,
exactly.
You lost shadow, you lost your soul, you were scared, frightened.
You're frightened.
See, el susto is like being afraid. Right.
Right.
Oof. Yeah, but it's like so normal, no? It's like, okay, it happens.
It's a
like,
commonality. It's like, oh, everybody at some point in their life will experience this. And that's, in my experience, is true, right? For myself too, right? I'm not separate from that.
Exactly. So, I mean, yeah, exactly. Who hasn't? I don't know anyone that hasn't.
Right.
I don't know anyone. And for you, not for you to give like a very personal example, but for you, could you tell us a bit about your own experience?
Yeah.
When and what happened and what shifted and how did it feel in your body, in your everything?
So for me, it was more childhood based. I think psychology would define it as medicalized trauma, which is defined by medicine-induced trauma due to an injury or due to a chronic issue physically. So when I was born, I had a staph infection that created issues with my hip and growth plates. And so when I was about 9 years old, I had a total body cast from my hips, from my ribs down to my legs. And so I was immobilized in this body cast. And I distinctly remember my soul, which I wouldn't have defined it as that, but I felt my body.
Can't hear you. Oh.
Created. Oh, can you hear me now?
No, I can hear you, sorry.
With this separateness, I became, my body and my spirit were separate.
Oh.
But I distinctly remember the two leaving one another. And what later on I would understand is that that was due to pain. There was too much in the body. So this pain pushed my spirit out. And it was still very much part of me. I could call it in at any time. I would mostly do so in my dreams when I had less pain. And through this age 9, 10, 11, 12, there was this in and out of my spirit. And in my mid-20s, early 30s, I would say, I saw a healer in Brazil that for the first time in my adult life was able to bring consciousness to this ability for my soul to travel out and come back. And I thought that was perfectly normal. I also used to pick my dreams and have these profound pieces of myself that were like, oh, I thought everybody could do that.
Yeah, I wouldn't be surprised. It doesn't, coming from you, it's not surprising.
Right. So finding out later, I was like, oh, that's not normal, and that's probably not really an integrated way of living. And so come my 30s, I'm 37 now. The last 7 years, I would say, would be more so dedicating my work to understanding how to integrate my soul back into my body, regardless of the pain that I have experienced over surgeries over the last few years, is how do I stay in this integrated state, regardless of pain, so that I can be in a more present space. And I think that word presence is really important as well. I think it brings up a lot of things in resistance for within my culture of like, what does present mean? What does presence mean for you, Alejandro?
Just being here and listening and not thinking about other things.
Yeah. And what do you like in your body? What does presence mean?
Yeah, just that's a great question, but it has to do with that. No, it's me listening to you, but knowing that I'm here.
Right.
It's feeling grounded, and being present. Pues eso, no, allows you to catch yourself from the mental chatter with which always fogs our perception of things.
Right.
Being present is okay. Having 100% present is having no chatter.
Okay.
That for me, that would be ideal.
Sure. I mean, is it always
ideal? So it was just like me and my perception, and just me just perceiving life, no, and listening and interacting. It's not just attaching. It's not that. No? On the contrary, it's just being me really listening to you, or to whomever.
right.
And being aware. Awareness would be a good word. Being present equals being aware. And that gives you that, no, a grounding sensation, devoid of anxiety and everything that comes with the mental chatter. Yeah, because when we're present, then all of those, I guess, I think I'm going to contradict myself. I was going to say that all of those things, they just fade, but they don't, no? Because sometimes to be present with their anxiety or their pain in order to understand what's going on and to listen to what it has to say. Yeah?
Yeah.
But being,
that's a big,
in general, would be that, no? It's just, okay, this is, I am here, and I'm here speaking with you. I'm not thinking about my pain, or I'm not thinking about other things. It's just me being present, doing what I have to do.
right.
Yeah? If that makes any sense. But if I need to be present with a pain, then I'll be present with that pain in order for it to tell me what goes on. Just like
Yeah.
two examples you gave. No, does that make any sense? Or
I think it makes a lot of presence. I think that's what we're talking about is, you know, as difficult as it is to be present with what is, the conditioning is to be with the next thing,
Yeah.
right? To be really present is about a degree of surrendering into what might be. And that may be really uncomfortable. And so much of this work, when it comes to soul retrieval or soul loss, is about learning the joy in being uncomfortable because of the gift that comes out of that, of space of in between that says, oh, you know, this is not comfortable and I know it's temporary.
Yeah.
And for me in my life, that's what chronic pain has taught me, is that it is temporary.
Wow.
And as much as it comes and goes, there's always spaces in which there is joy and there's grace and there's all these other things. As long as I have been humbled by the fact that there is a surrendering that happens and a recognition that this is what it is right now. And that there's always external things we can seek. But until we get really calm and really present with actually what's happening in here, then all of that is just a seeking.
Mm-hmm.
And none of us are broken.
Into what? I'm sorry?
A seeking to try and fix something.
Okay.
About, right? So being present isn't about seeking what I need to fix next. It's being really clear with what is in the present moment without the external noise, right? And which is really hard to do. Let's be honest. It's not easy. And yet, in the glimpses that we're able to get there through practice, through support, through dialogue with people that we trust and love and care about, the more ease we create within that space of quiet. And unless we have that quiet, it's really difficult to know what's actually happening in our heart or happening with our soul, right?
Yeah, and maybe part of that chatter when it's very intense,
Mm-hmm.
within, I mean, with one particular thought or attitude or feeling,
right?
Then we may get attached to that, and also we can get soul loss out of that.
Yeah,
being
exactly.
angry all the time, or being sad, or being complaining all the time, but like with long periods of time and being very intense with it. So that's a very interesting thing. No, I mean, so many things can, according to the elders, can just pull us away from, or can drain our essence. No, we're so frail.
I know we're very vulnerable creatures, this human body of ours. And this experience, I think you bring up a good point about the elders component, like the influence of our ancestors, the influence of what our spirit came into this body in this carnation, in this lifetime, might not even be in this present lifetime. It might be what you're bringing in too, that we're navigating in this karma or whatever we want to call it, that is still replaying itself, in which you've got some really critical choice points in your life to either continue that lineage or continue that path, or to say, no, I want to do it differently. Now, I'm simplifying, of course.
Oh, I know.
It's hard, and it's possible. But I do want to recognize that, like, this conversation around soul loss or soul retrieval is super difficult and never intended to do it by oneself. Right? What about you, Alejandro? Where in your life have you felt soul loss or felt that peace?
So many times.
Sure. We've talked.
Mistakes. Yeah. Like I guess one of the components of retrieving your soul is being responsible.
Okay.
You haven't mentioned it. I know it's very present in your work. But I guess, through plant medicine. Yeah. Misuse of plant medicine. Meaning sacred or power plants. You know, that would be one.
Responsibility. Like you speak about responsibility in plant medicine. Is that what you're recognizing?
Taking responsibility of what you did, or what I did in this case.
Okay.
right? So, okay, or whatever, no? I could have done something else, but taking responsibility that instead of me complaining about what happened to me is like, okay, yeah, this happened to me because I did this and this and this, or I allowed this and this and that. Sometimes we're powerless, and there are situations in our life where we just we're confronted with certain things, and we're in that moment we're powerless.
Right.
But later on, we can retrieve our power and then heal from that trauma.
Right.
That makes sense. But yeah, in this case, I mean, just yeah, it was that, and so I thought at that point, this was a few decades ago, I thought that I just doing plant medicine would just bring me to God, really. That's what I was looking for. Yeah, and it did show me a part of God, but not the part that I wanted. Yeah, but that now I understand what happened because I went into certain worlds that I wasn't supposed to go to accidentally. Mm-hmm. And without having the respect of for the plant or the situation or myself, and just thinking that it was something that without any preparation I could just go and do, no?
Right.
Go and do, and my ego said no, you're powerful enough to deal with whatever, but that was just like, the ego is very minuscule and very dumb.
Yeah.
So yeah, so that, and but it took a long time. It took a long time. My first soul retrieval was with Lupe. Do you know Lupe? Yeah.
I don't know if I've met her or not. I know you've talked to
Yeah.
her. I know.
She's a healer in Oaxaca, and she's also a guide for mushroom ceremony.
Oh, yes. You've spoken of her. Mm-hmm.
Yeah, she's a great lady. You have to meet her when you come.
One day soon.
She's fun. She's fun. She's a great lady. And so that was my first soul retrieval. Yeah, that was my first soul retrieval. And to be honest, I think I needed like 120 soul retrievals. And no, but it does. It's really impressive how it does work, even when somebody when the soul retrieval is being performed or done. One doesn't feel anything sometimes. I mean, I was numb, so I mean, I didn't feel anything.
I like to think it's like a subtle realization over a period of time.
Exactly.
Acutely necessarily profound, but you notice this distinct self that comes back on board.
Oh yeah.
The quieting of the mind. It's just very, only you know it, essentially.
Exactly. Very interesting because it is palpable. It is.
But not verbal. And I think that's a big part of this work, is that so much of it is nonverbal. It's experiential, right?
Exactly.
This soul retrieval, this part,
theoretical,
right?
It's practical.
It is very practical and it's very tangible. It's not something that we can, really go into necessarily detail as much as we could go into the mind about it. Yeah. But I think important is what does your body say after? What does your heart say after? Because so oftentimes with those chronic pain people, the pain's gone. Like what you described with your friend the other day. That ability to drop in and dialogue and then said, this is really about this fear of not being feminine or fear of this. The more we're able to identify the feeling and the location in the body and where that resides within our experience of life, the more shift I think that we see happen as external helpers, right?
Exactly.
To not, and that's I think our role too as the practitioner or the healer or the helper, the shaman, whatever we want to call it, is to hold space and really clear that the intention is for them to do the work and us to hold their hand, to recognize that they know themselves better than anybody. Yeah. And that ultimately they're in control and
or they could know themselves. Well, they do know themselves. No, there are some people that are numb and they just don't want to.
Right.
but
I think it's more than just wanting to, that it might be just too hard to get there.
Yeah.
Right?
Yeah.
Or
And
too scared, whatever it might be.
I've seen the work you've done with some of your clients, and it's really impressive, like that I've seen.
Mm.
I mean, when I've been granted
And stuff.
helping and working with you, it's really impressive what I see with your clients. It's just like the shift
Mm-hmm. Yeah.
in awareness and in healing and in, yeah,
Thank you.
very
And for me,
profound. Yeah, I do it. Yeah, I might sound like I'm how do you say, like estoy haciendo la barba anyway. I'm just uh, speaking too well about you, but I do admire your work. So would you briefly tell me how you started with this, and
yeah,
sort of like your very brief, like voyage till
sure.
your practice?
I would say for me, it is a combination of a lot of things, but typically someone that comes in, I frame it as more of a clearing or a reading, or um, I call myself more of a spiritual mentor. So when I partner with someone that wants to explore this work, I personally don't integrate plant medicine outside of topical plants that I might integrate for clearing. And that might be in part of the
Master herbologist.
Yeah, so herbalist as well.
Herbalist.
They might bring in more herbs on a therapeutic level,
Mm-hmm.
rather than psychedelic level. So I typically meet one-on-one, and I give myself enough time, a space, about an hour and a half to 2 hours minimum, in which we start out with a dialogue. So what brings you here? And from that, who are you? And from that, what is it that's going on in your body that you're curious about? And then typically there is a conversation around some event that might have happened, in which afterward they never felt the same. And they felt like a part of themselves was never quite back. And so those are my key phrases or key things that I ask into in those initial conversations. Not everyone I see has soul loss, but everyone I see to some degree, because all of us have a collective experience of trauma. So I work on more of a spectrum, from small traumas to bigger traumas, which are going to be more of these loss of self, loss of soul. So the first part of that initial conversation is around identifying what we're working with, getting what I call a baseline of what does the nervous system look like. I usually get them onto the table. I do craniosacral work in which I look at what is the nervous system saying, how able are they actually to be on the table and calm and be able to breathe or rest, or am I working with something that's neurological, in which everything is a fight or flight? And that's usually indicative of someone that's got more soul loss. So I might pivot into bringing in some herbs or copal or an egg for an egg reading, or a limpia with that, in which the egg embodies that person from the inside out and helps to examine or remove anything that doesn't need to be with them. A lot of that, I tend not to use the word prayer, but there's intention that goes in with it. And I oftentimes ask them to bring in any spiritual guides that they might have, or any positive affirmations, whatever it might look like, to join us in that session. So for me, everyone looks a little different, but there's usually a pretty clear map. Starts with dialogue. Who are you? What's going on? How's it show up? Body, mind, spirit, emotion, body work, in which I'm looking at the nervous system. I'm looking at how is the body holding tension. And then I'll typically ask about, can you tell me more what's going on here? Was there an injury? What comes up? What emotion shows up here when I talk about it? And then from there, we'll clear. And so we end up being in this open space where it's like, oh, what do you realize in your body afterward, right? What do you notice? And I asked them to take the next 3 days to really journal or ask into what showed up, how did they show up differently for people in their life, for themselves, and for within their body, and what was difficult, what was it? And I usually do this over 3 series. So first one, lay of the land. Second one, we dive a little deeper, what showed up in the last session. And then we'll go straight there, whether that's soul loss or something less than more deep work. We're still going to work with the nervous system, the physical body, and looking at where those emotions might be still stuck or needing some recognition. And oftentimes, as you can probably relate, is when we acknowledge where that emotion might be, we can release it, right? And that usually shows up as pain in the body or tension or headaches or migraines. So those for me are big red flags or indicators that this is the work that we're working on clearing or helping them realize and honor in themselves. I don't do anything to remove anything. It's on them. And I simply hold space to allow that to unfold. And I'm more of a channel or a vessel between that, in which I support their process independently so that they know that they're not alone in it, but that there is someone else that can help them through this work, as complicated or uncomplicated as it might be.
It brings a lot of empowerment.
It does.
No, you help them.
That's the word for it.
In a spot of empowerment. No, it's me doing the healing. I'm just
it's really about reminding people that they're capable to heal themselves, and that we, all of us, myself included, forget that sometimes, and we seek this external recognition of heal me, heal me, heal me, when oftentimes if we get quiet and create the space to allow ourselves to ask, what do I want, what do I need, and how do I feel, then so oftentimes we can heal a lot of what's going on in ourselves.
Who am I? What do I need?
What do I want?
What I want.
What do I need?
Okay.
And what's the last one? What do I want? What do I need? And how do I do it, I guess, too, is the big part of that.
Okay. Just one last thing before I've had you here for too long.
Okay.
You, as I mentioned before, one of the major pillars in your work has been working with the reproductive system of women.
Yeah, absolutely.
Right? Help them into having more fertility or healing different issues, within the female reproductive system, which it's interesting because I've met a lot of parteras and traditional healers that work with that too, as you know. And for some reason, I don't know, I mean, it's in my path, I've met so many, and I find it very interesting yet sad that there's more and more women having problems with their system. But anyway, and knowing that there are paths outside of conventional modern medicine that can heal them, even sometimes fast, but very quickly. But my question was regarding something you said the other day, that working with women, you would be able to heal their wounds also by doing soul retrieval or some sort of soul retrieval, but that you found out that okay, men have the same traumatic or emotional impacts, but you need to work them differently.
Yeah.
But that, I'm sorry, that gave you an awareness that there was more to the womb. It was like a soul thing. It was more like a universal thing. Yeah.
Yeah, I think that's a good way to describe it. So a lot of my body work focuses on abdominal massage therapy with both men and women, predominantly women, but men too, in which case I have noticed this across the board is that soul loss and womb work are not separate. That so much of being feminine and this fertility and this sense of source and the seed resides within the womb, which is very much the same conversation around loss of soul. And for those that might be struggling with fertility, this work is very much in alignment in the same way. And I would say men too, this loss of self and masculinity or whatever it might be, stomach issues, it's about swallowing those emotions. It's about these other parts of us that default to the belly, which is our more vulnerable space as humans, right? That we try to protect and hold. And if we think about it, our soul very much resides within the same area. So when we talk about soul loss, we're talking about regaining of self within our uterus. Oftentimes in the fertility work I do, there is a disconnect that's been cultivated from this failure for the womb to produce what it is we want, which is a child in often cases. And so I partner
Project.
What?
Or a project.
Or a project, right? It's gonna do this, it's this timeline, it's very linear. And when I partner with someone that's doing fertility work in a more Western medicine sense, they're not separate. If anything, they're distinctly helpful. And that it reminds the softness that is needed to create a life. And so when we get stuck in this structure that's very linear, that's very timed, and it's very separate from our womb, that is a loss of soul for women. Because we're suddenly surrendering our womb to an external self or external group to tell us how to make it work, right? That essentially is the same thing as losing ourself, especially in women. Men, I don't think are separate from that. I think men experience that in a distinctly different way, but one and the same. Universally, the loss of sense of self due to Western medicine being like, well, it has to look this way, be these numbers, be this or that. Or for men, the loss of ability to produce fertility, whatever it might be, is a loss of sense of self as well. And I think that's where our conversation that we had the other day identifies this inability to say we're equal in the sense of, yes, there's separate parts and separate parts of us that make us man and women, or in between transgender as well. But ultimately, the loss of soul is what we're talking about, the loss of sense of human. And I think that that's the bigger piece that we seek when we ask for external help, whether that's in Western systems, traditional medicine, indigenous medicine, journeying, whatever it could be. We're asking, help me know myself more deeply.
We want to.
Gotta
Okay. How can anyone get in touch with you?
I'm available. I do a lot of my sessions over Zoom and in person in Charleston, South Carolina. There's a way I can integrate a lot of this work, even if we aren't in person. You can reach me via Instagram through here. Is probably easy. I also have a website, lotuscharleston.com, and I can be reached through that as well. Or through you, because Alejandro, me and you work fairly often as well with the ceremonies and the readings that we are doing alongside Julio. I think that work is profound in identifying what soul loss is and how we can collaborate more acutely too. So thank you.
So much. Thank you for your.
Well, till next time, hopefully we get to do this again soon.
Yeah.
Across the sea. We'll see you soon. Thank you so much, Alejandro.
Bye-bye. Good evening.
See you. Bye.
Yeah.